For growing children, what should they eat to make sure they get enough protein? Is there a way they can not get enough protein?
Can children not get enough protein? Certainly. I mean, children definitely have an increased protein need. If you're going to have a child that's going to follow an exclusively plant-based diet, you got to make sure that they are going for some of the bigger bang protein items. So, they've got to be eating legumes or some nuts and seeds. Otherwise, if they won't eat those foods, being vegan might not be a good idea, because you do need protein as you grow, but you don't need them to be eating double cheeseburgers. I mean, this idea, I'll go out to eat with my kids, with one of my friends and their kid orders a double cheeseburger and fries, and my kids are eating crudité and garbanzo bean soup, and they've got the nerve to say to me, aren't you worried about their nutrition? And their kid's eating a double cheeseburger? It's a little silly.
How does a vegan know if they're getting enough protein? What vegan foods have enough protein to live on?
Protein is very important, but it's everywhere. It's in all these different foods. I do think you need to concentrate on legumes because they have a high density of protein. I think a few nuts and seeds thrown in the mix will give you some added protein. There's protein in broccoli, there's protein in kale, there's protein everywhere. So you just have to have a varied plant-based diet that definitely has legumes in it. You'll get plenty of protein.
What is bariatric surgery and how effective is it? Do you recommend your patients change their diet instead of getting surgery whenever possible?
Bariatric surgery is surgery done in order to basically short circuit some of the circuitry that makes it very hard for people to lose weight. There are several different bariatric surgeries out there, different surgeries for weight loss. They are extremely effective, very, very effective. Do I have people change their diet to lose weight first? Yes, every one of my patients has to go through a preoperative program. They've got to see my dietitians, they have to change their diet, they have to see my exercise therapist, they have to see our psychologist. But in some patients, it is extraordinarily difficult to lose weight. This is partly genetic. If you look at genetic studies, twins that were separated at birth that grew up in different environments, if they're monozygotic twins, identical twins, it doesn't matter which environment they grow in, they have the same weight. But if they're dizygotic twins, meaning they're not identical, and they grow up in different environments, they'll have different weight. So there's definitely a genetic component. In fact, out of the gene studies and the adoption studies, we found that probably weight, maybe on par with height, are the most inherited genes we have. Now, obviously, there's an environmental effect too, but you got to understand that these genes are ancient. Our genes, we evolved at a time where food was not plentiful. There was a lot of fasting going on, and it wasn't intermittent fasting. It was winters without eating. So we evolved these big, large, floppy stomachs. We don't have a big, huge, stretchable stomach so that we get our dollar's worth at a buffet. We have a big, huge stomach so that when there was a kill or when there was a harvest or when there was a gathering, we could eat as much of that food as possible to get us through the winter. But now it's wintertime and you could get, McDonald's at 2 in the morning. And so those things are working against us. And an obese patient that has this kind of genetic propensity, and then put on at the environmental factors, they're growing up in a food desert. They've been fed junk food since they were a kid. They've got all these fat cells in their body. As soon as they lose weight, those fat cells stop secreting leptin. Leptin is a hormone that goes to the brain. The brain says, oh, I'm not getting enough leptin. I've got to increase hunger. Or they get ghrelin from the stomach that says, oh, you better eat. Very hard to lose weight in that situation, which is why diets don't work. No matter what you look at, no matter what diet, they just don't work long term. And weight loss surgery is important. I think globally, we need to look at eating more plants and eating more fiber and less calorie-dense food. We need to make sure that mothers, while they're pregnant, are eating less, because we know there's epigenetic changes with bad diets that can affect the kid. We know that we need to feed children better, because an obese child is going to become an obese adult. But when you're dealing one-on-one, like I do on a day-to-day basis, with a person who's really struggling with their weight, weight loss surgery offers a very important tool. It's not the end-all be-all, but it's a tool to help them lead a longer, healthier life.
Do you recommend cholesterol-lowering drugs? Why or why not?
Do I recommend cholesterol-lowering drugs? Of course I do. There needs to be diet is important. And so diet's always going to be my primary recommendation. There are situations where diet doesn't work, whether it's obesity, whether it's heart disease. Cholesterol, if you've got high cholesterol and you go on a diet and you can't get that cholesterol down because you've got a genetic inability to get that cholesterol down, you better take those medications. The research is extremely strong for this. It would be malpractice, I think, to tell someone not to, based on the available research we have.